You may have already gotten notifications from your pharmacy or doctor to schedule a flu shot. Chris Bryant spoke with a healthcare professional about what to expect from the upcoming flu season.
The new flu season is expected to start in October, and in Missouri, during the previous flu season, influenza A was the most common strain that doctors treated.
It seems like every year the flu season sort of extends further and further into the spring months. So that's something to be aware of, and when you're deciding about when to get the vaccine, I think that's a question I get a lot. And I used to say, as soon as it's available, maybe you should get it. But it's a timing issue too, because that flu season does extend sometimes into May.
According to the Missouri Department of Health and Senior Services, in 2024 and 2025, the flu season saw higher cases than the previous year. In total, there was a total of just over 137,000 cases of the flu in the season. When it comes to deciding whether to get vaccinated, Dr. Taylor Nelson with the University of Missouri Health says it isn't just about protecting yourself.
Individual level, it's of course important to protect yourself, but you're also protecting your loved ones, your friends, people you don't even know who may have a higher risk for more severe infection.
The CDC recommends that most people get the flu shot starting in September or October, and with those that are high risk of severe complications, getting them in early September. In addition, it's important to note that the flu vaccine takes about 2 weeks to become effective. Therefore, it's best to get vaccinated early in the flu season to ensure maximum protection.
No vaccine is perfect. Certainly, there are times where we have people who get infections who've had the vaccine. And so, we're not shooting for 100% protection necessarily. But if you do get the vaccine, typically you'll have a milder illness as well.
Healthcare providers say if you have questions or concerns about getting a flu shot, it's best to talk with your healthcare providers when it comes to your concerns.
Very, very rare exceptions. Someone who is truly allergic to maybe the vaccine components that are used, and not just egg-based. We do have non-egg-based vaccines. And so there are many, many times we can get around any potential concerns for allergies. So I think essentially anybody who's over the age of 6 months, in particular, it's important if you do have those, those comorbidities, heart conditions, lung conditions, advanced ages, those kinds of things, because the flu can actually cause a more severe illness and sometimes even death.
In the newsroom, Chris Bryant, KY3 News.